Hi there, my name is Christina Bright. I am a registered nurse and I currently work at a level 2 trauma emergency care department in Asheville, North Carolina. I have recently taken part in a collegiate debate regarding the North Carolina House Bill number 879, the End of Life Option Act. The argument that I found to be the best in support of the End of Life Option Act is the patient's right to autonomy for end-of-life choices with a prognosis of less than 6 months to live. The most important argument against the End-of-Life Option Act, in my opinion, is that the physician's estimation of the amount of time a person has left to live can be inaccurate and lead people to make life and death decisions without assuredly knowing that they have minimal time remaining in their life. The End-of-Life Option Act currently resides at the state level in North Carolina and was introduced in April of 2019 and is being referred to the Rules, Calendar, and Operations of the House. After much debate among my fellow colleagues, I have found myself in support for the bill in the process of moving forward. My reasonings for that are number one, patients with sound mind have a right to autonomy not only in life, but should also receive the same autonomy in regards to their death. Individuals should have the right to decide how they live their own life. Only an individual can measure his or her quality of life, and only an individual can determine when that life is not worth living. My second reason is medical resources should be reserved for those patients that actually wish to live. This line of reasoning suggests that it is preferable to deploy medical professionals, equipment, and hospital beds serving the needs of patients who wish to live rather than prolonging the lives of those who would prefer to die. And thirdly, allowing a patient the choice of dying with a terminal prognosis can be considered an act of mercy. This aids in eliminating traumatic suicides by means of planned death. Relieving pain, even if it hastens the death of a terminally ill person, is considered the ethical and moral obligation of the professional nurse. I think the bill should move forward to the House floor for consideration, and I feel like this bill needs to be carefully developed and reviewed for maximum benefit for not only patients, but also the safety and protection of our medical staff as well. The bill will stir up many personal feelings and beliefs and is not going to be accepted unanimously by society in general, but I think by making the appropriate processes and the checks and balances between the physician and the patients, I think that we can come together to make a pretty reasonable bill that once again won't be accepted by everybody, but it can benefit the person who is at the center of the bill, which is the person with the terminal illness, in making the right and most right decision for themselves. Thank you so much.